Often I see patients in my office for revisional surgery. Unfortunately, about half of my practice is redos, and often I hear patients say, if only I had known. This video is designed in order to give you the information, that is the questions you should be asking before you undergo any plastic surgery, so you do it without wishing you had asked. So remember, plastic surgery for a lot of doctors is a business, and the business is about making money. So what are the key elements to know? Number one is, where are you going to have your procedure done? Are you going to a doctor whose resume you can read, or are you going to an institute, something you heard on the radio, or a facility? If you're going to a facility, then you don't know who the doctor is. It's the doc du jour, that is the doctor of the day. That's a big problem. Once you've identified who your doctor is, obviously the most important thing is your surgeon, you gotta ask, where did he get trained? What did he get trained in? So make sure you know the distinction between a plastic surgeon and a cosmetic surgeon. Listen carefully, this is really confusing. People think that a cosmetic surgeon is the same thing as a plastic surgeon, and it is not. Anyone can be a cosmetic surgeon. Your OBGYN can decide tomorrow he or she wants to be a cosmetic surgeon. There is no cosmetic surgery school. It is a program that you learn outside of residency. Plastic surgeons have a training program. Believe me, you need to ask. Once you've determined that your doctor is indeed a plastic surgeon, ask, is he board certified? Don't be confused and say, my doctor is a cosmetic surgeon who's board certified. You have to ask, what are you board certified in? It might very well be an OBGYN. So you want to say, my doctor is a plastic surgeon who is board certified in plastic surgery. Then you're safe. Next, you have to ask, where is my procedure being done? In what facility? I can't tell you how many patients have no idea where their surgery is being done. Much like a restaurant, surgery centers get grades. You would never go to a restaurant that received a C grade. Therefore, you should never go to a facility that doesn't have the highest recommendations. So in the world of surgery centers, MEDICARE certification is the A grade. Make sure your facility is MEDICARE certified. Next question is, how long does the procedure take? In plastic surgery, faster is not better. Longer is better. This is handmade. You want to take your time. The faster a procedure done is, the less it costs the doctor and the more money stays in his pocket. The longer the procedure, the better the accuracy. Next, who's doing your anesthesia? Who's your anesthesia provider? The co-captain with your surgeon. No one asks who's doing my anesthesia. They just assume, well, there's a big distinction. You can have an anesthesiologist who's a doctor, or you can have a CRNA or a nurse practitioner. There's a big distinction, and often it's cost. Make sure that you ask that your surgeon is using an anesthesiologist. I think it's really important. Next, how often am I going to see my doctor in follow-up? Most doctors see you twice. I see you 5 times. The follow-ups is when I can assure that you're healing well and we can discuss what's going on. So make sure you have adequate follow-up. And finally, who is going to see you at every visit? So from the initial consult all the way to your last visit, you want to make sure that your doctor sees you. In my office, I'm the only one that sees you. No nurse, no coordinator, no receptionist is going to substitute for the care that your doctor can provide. And you want to make sure you ask for that because you paid for it. So basically, these are just a few of the little things that I think will help you and guide you in order to navigate the sort of pitfalls of plastic surgery and make sure that you have an amazing and wonderful experience.